The following segment is sponsored by Delta Dental. Menopause affects the whole body, but oral health is often left out of the discussion. CEO of Delta Dental, Sarah Chavarria, is here to share how dentists play a role in supporting women's overall health during menopause. Welcome to the show, Sarah.
Thank you.
We often hear about hot flashes, right, during menopause, but not oral health. How does menopause affect a woman's teeth and gums?
So think about going through those hormonal changes. They impact our estrogen and they reduce our saliva production. And so when that happens, we have 40% of women reporting dry mouth. We have about a quarter of women talking about things like, tingling or burning tongue, bleeding gums, changes in taste. Those are all impacts from that change in our hormones that we go through when we go through perimenopause, menopause. And 83% of women still say they did not know there was that link. So thank you for asking.
Yes, of course. And how can dentists play a role in supporting women's overall health during menopause?
They're such a critical part because you imagine we go to the dentist twice a year and we might go to the doctor once a year. So there's two healthcare checkpoints with a healthcare professional with whom we can talk about the symptoms that we're feeling, the differences that we're seeing in our overall health. And they can really help either take care of our oral health while we're in the chair, but they can also give us a lot of great information and connect us to a healthcare provider if they're seeing something that might be pointing to something else. So they're in a beautiful spot for us to interact with twice a year.
That's a really good point, Sarah. And why is it important for women to feel comfortable about raising the topic during a dental visit? Because it can be uncomfortable.
It can. And we've said, look, if you're not comfortable walking in like, hey, I'm in menopause, maybe walk in and talk about the symptoms. But one of the things that we learned from women this year was, hey, if I had a benefit that was for women, I'd be more likely to talk about it. And dentists said, if a woman walked in with a benefit for women, I'd be more likely to talk about it. So we're going to test that next year. In 26, we're going to actually launch a dental benefit for women so that women who are going through pregnancy, perimenopause, menopause, and those hormonal changes can walk in with a benefit that we do hope will close the gap, and it'll have an extra visit or two. It'll have extra experiences for the woman while she's in the dental chair. So we're really excited about what we've learned in the 3 years we've been doing this and talking to women and talking to dentists, and now kind of testing something new out.
Sure, that's a great idea. Absolutely. And what changes are you hoping to see as more women learn about the link between menopause and their oral health?
Look, fundamentally, the big change is, as a menopausal woman myself, I can relate to women saying, I've missed work because of menopause. I feel less confident. It has impacted my career and a whole host of other things. So primarily, I want women to really grow in confidence, learning about how menopause impacts their overall health through their oral health. And I want them to really start to reimagine that dental visit as a preventative care step, because it's access. We're having access to a healthcare person right there. And so I'm really just hoping to close the gap, bring awareness, talk about it, and then see what we can do as an insurance company to help guide that care in different ways.
Absolutely. All the information is on your screen if you would like more. Thank you so much for joining me today, Sarah. Have a wonderful day.
You too. Thank you so much.